Hello, my name is Carly Miller. I'm just going to be doing your head-to-toe assessment. Do you have any questions? I'm just going to wash my hands first, okay? Washing hands. Okay. The first thing I'm going to do, I'm just going to take a look at your head and all the structures around a part of your head. I'm looking at the head size, shape, configuration. Now I'm going to look at the skin on your face. I'm just looking. I'm looking at your external nose, external eye. Eyelashes are evenly distributed, no crust in the eyes. Right, looking at your skull and your hair, looking at the external ears. Now I'm just going to pull down on your bottom eyelid and I'm going to look at your conjunctiva, okay? Could you look up at me? Look up. Okay, perfect. It's pink and moist. And the sclera looks good. All right, so now I'm just going to touch. I'm going to go ahead and touch your head, okay? I'm just palpating, feeling for any lesions or abnormalities. All right, does that hurt at all? Not uncomfortable at all? Hair is thick, evenly distributed, and supple. Now I'm going to palpate your temporal artery. Let me know if you feel any discomfort. No discomfort? Okay, that is 1+ bilateral, non-tender. Now we're going to go ahead and do TMJ. Can you open your mouth and close it? Did that hurt at all? No discomfort? There was no popping, no crepitus. All right. Now I'm going to have you to bite down hard. Are you clenching your teeth?
Mm-hmm.
I'm going to feel here. I should feel the knot of muscle. The temporalis. Are you still biting down? Okay. Perfect. Now I'm going to test soft touch. I'm just going to use this. Can you close your eyes and just say yes if you feel something touch your face, okay?
Yes. 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 Yes.
Okay. Now we're going to test cranial nerve 7. Can I have you wrinkle your forehead? Close your eyes. Smile. Pucker your lips. Show your teeth. Puff out your chest. Now, can you just look at me? I'm just going to put this close to your eye. Do whatever feels natural, okay? Okay, perfect. Bilateral blink whenever I put the cotton swab to the corner. And the same on the other eye. So now I'm just going to look at your nose. And look on the outside. Can you look up? I'm going to use my pen light. I'm using a utensil as pen light. My pen light broke. Just looking. Okay, it is patent. Do you have any issues with your nose lately? Any tenderness? Nothing new going on? Okay. Now I'm just going to palpate your nose. Just touching. Tell me if you feel any discomfort, okay? All right. Nose looks and feels symmetrical. No tenderness. Now I'm going to palpate your sinuses. You tell me if you feel any discomfort at all. Okay, and the nose is patent. So now for cranial nerve 1, I'm going to have you hold one nostril and take a breath. Breathe in and do it with the other nostril. So now I'm going to put something outside your nose. Block one nostril and tell me what you smell. And keep your eyes closed, please.
Coffee grounds.
Okay, other one.
Coffee grounds.
You smelled it with both nostrils?
Yes.
All right, now I'm going to look inside your mouth. I'm going to look at your buccal mucosa. I'm going to use my pen light. Open for me. Perfect, pink and moist. I'm going to look inside your lip. Looking at your gums and teeth, they are white. All right, can you stick your tongue out? Okay, tongue is at midline, tongue is pink. Can you put your tongue up, down, side, side? All right, perfect. Now we are going to, let me see your tongue. Okay, open your mouth, stick your tongue out. I'm going to look at your tonsils in the back of your throat. Okay, now I'm going to test cranial nerves 9 and 10. Whenever you stick your tongue out, can you say ah?
Ah.
Perfect. Uvula lifted up. All right, perfect. Okay, so we said tongue was symmetrical, cranial nerve 12. Now I'm going to go ahead and take a look at we already looked at your ears, so now I'm going to examine your ears. I'm just going to look at them. Using my pen light, taking a look. Have you had any issues with your ears lately?
No.
Okay. Now I'm just going to touch your ears. I'm feeling the tragus. No pain. Ears are symmetrical. So now we're going to test your visual fields. So I'm going to pull a chair up close to you. I'm just going to be like 2 feet away from you. I'm going to, you cover this eye. I'm going to cover the eye that's right across from you. So I'm going to hold up numbers in all 4 visual fields. You just tell me those numbers.
Okay.
So, ready?
1, 2, 3, 4.
Okay, good job not looking away from my eye. We're going to do it on the other side now. You ready?
1, 2, 3, 4.
Good job. Now you can take your hand away from your eye. I think you can lift it up. We're still checking your eyes. I'm going to go ahead and check your pupillary reaction to light. So you just focus on that wall. I'm just going to shine this light on your eye. Perfect. Okay, pupils reacted immediately and they were equally constricted. Now I'm going to have you still focus on that object on the wall over there, and I'm going to have you follow my finger. Okay. Actually, now back to your hearing. I am going to do a whisper test. So your job is just to, right now you're going to plug this ear, press on your tragus to block your hearing. I'm going to whisper a word. You just repeat that word to me, okay? I'm so sorry. Can we move you up, sir, so that you can be in the... Okay.
Apple.
Okay, can you block the other ear now?
Yellow.
Okay, good job. Now we're going to go ahead and perform another hearing test. We're going to do the Rhine test. So I'm going to do 2 positions with this tuning fork. You're going to hear vibrating. There's going to be position A and position B. You just tell me which one you hear better, okay? So I'm going to strike the tuning fork. This is my makeshift tuning fork, by the way. Sorry. We're going to strike this. Put it by your ear. That is position A. Putting on your bone. Position B. Which one did you hear better?
A.
Okay. On the same on other side. That's position A. And that's position B. Which one did you hear better?
A.
Okay, now I'm going to do the Weber test. I'm going to put it in the middle of your head. Tell me if you hear it better the right, the left, or if you can hear it in the middle, okay? Where did you hear it?
Middle.
Middle, okay. All right. Now I'm going to look at your neck, just looking first, okay? Looking for symmetry, any pulsations. Okay. Now I'm going to go ahead and palpate your trachea. Just touching, okay? Do you feel any discomfort? Trachea is midline. Now I'm going to palpate your thyroid. Can you swallow? All right, perfect. Do you feel any discomfort when I touch your neck?
Mm-hmm.
Okay, no lesions or abnormalities noted. Now we are going to palpate your lymph nodes. Lymph nodes. Okay. You tell me if you feel any discomfort, okay? Ocular in front of the ears, behind the ear. Occipital is back here. Supramandibular, submental. Okay. I'm going to go ahead and palpate your carotid pulses now, okay? Okay. Perfect. They're bounding bilateral. I'm going to get to, I need to see the range of motion of your neck. So can you lean your neck back? And forward? Can you lean right and left? Look right? Look left? Perfect. Can you shrug? Okay, now I'm going to put some pressure on your shoulders. Try to shrug. All right, perfect. Now put your shoulders up. I'm going to try to push them down. Okay, perfect. That's cranial nerve 11 is intact. Now I'm going to inspect the skin and color of your arms. Usually for this, you would have a short sleeve on. Okay, I'm just inspecting, looking. Can you turn your arms over? Okay, perfect. Now I'm just going to touch for temperature. They're both warm. Arms look symmetrical. Feeling for any edema. I'm going to check your capillary refill. Come on. Let me see your fingers, please. Okay, all of them are less than 3 seconds. Perfect. I'm going to check the range of motion of your fingers. Can you squeeze? Open as big as you can. Can you bend your thumb this way? Can you do your wrist down? Wrist up? Side? Side? Can you flex your arms for range of motion of your elbows? Now I'm going to check range of motion of your shoulders. Actually, can you stand for this? Make it a little, just make sure you're in view, please. Okay, can you face the camera? Raise your arms away as far as possible. This is abduction. Okay, and back down, and then raise your arms up as far as possible. And then turn to the side and put your arms back like this as far as possible. Perfect. Okay, you can go ahead and have a seat now. I'm going to go ahead and do the soft touch again where you close your eyes and tell me if you feel anything touching, okay?
Yeah. 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 Yeah.
Also, another thing I missed on the fingers, there was no clubbing, which could be a sign of chronic hypoxia. Okay, so we're done with the soft touch. So we've done your arm. Let me do your radial pulses. Can you turn these over? Just going to feel bilateral radial pulses. Okay, they're symmetrical. Perfect. I'm going to kind of palpate your elbows, just feeling the joints. Do you feel any pain or discomfort? Any pain or discomfort? All right, we already did range of motion of the elbows. We got all those. Can you squeeze my fingers as hard as you can? Ouch. Perfect. Okay, bilateral strong grip. Now I'm going to go ahead, for this part in the clinical setting, we would have the shirt off, but for video purposes and respect his wishes, the shirt's on. So we are going to pretend a little bit. I'm going to go ahead and inspect the thorax, look at the skin, look at the symmetry, make sure there's no lesions. I'm going to make sure he's not using any accessory muscles for respiratory, make sure he's not having labored breathing, everything looks good. I'm going to touch your chest wall, okay? You just tell me if anything hurts. Feeling for any tenderness or masses, no pain? I'm going to touch back here, okay? Can you just lean up? We're going to do the posterior breath sounds. All right. I'm just going to put this under your shirt, okay? Can you lean up a little? I'm going to start up here under the clavicle. We're going to be at the apex of the lungs. Take a deep breath every time I move my stethoscope, okay? So on the right lung, the two under the apex of the lung are going to be the upper lobe. The two after that will be middle lobe, and the two after that will be lower lobe. And then on the left lung, the four under the clavicle are all upper lobe. And then the last two are the lower lobe. Going to the side here. Okay, and we already palpated for any pain or tenderness back there. While we're on the back, I'm going to go ahead and just palpate for any pain or anything on your spine here. Can you just lean up? We're going to do all levels of your spine. You tell me if you feel any discomfort, okay? Okay, so now I'm going to do the expansion with your respirations. Can you lean forward? My thumbs are together. Now just take a deep breath. Perfect. I'm going to do the same thing on the front. You can get back a little bit now. Okay, good chest expansion. Now I'm going to go ahead and also take breath sounds on the front side, the anterior side. I'm going to go under here, okay? Going under your clavicle at the apex of the lung. Take a deep breath every time I move it. Okay, now I'm going to have you stand up and turn to the side. I am just going to be comparing, doing your transverse diameter, and the ratio is 1 to 2. That is normal. You can have a seat. I'm going to go ahead and check your respiration right now. Okay, respirations for 1 minute were 15. That is normal. Respiration should be between 12 and 20. They are unlabored. Now I'm going to listen to your heart sounds. I'm going to go under your shirt again, okay? Oh, I'm now at tricuspid. And below the nipple right here is going to be the mitral area. Okay, S1 and S2 heard. Heart sounds sound normal. Now for the abdomen, can I have you lay on the bed? Okay, so like I said, the shirt would be off at this point. We are just pretending. Okay, I'm inspecting the abdomen. I'm just looking at the skin. I am looking for any lesions, abnormalities. I'm looking at the umbilicus. Umbilicus is round and midline. Now I'm going to go ahead and auscultate vowel sounds in all 4 quadrants. I'm going to put this under your shirt again, okay? I'm going to do all 4 quadrants for 1 minute. 1 minute each quadrant, 60 seconds for each quadrant. Okay, vowel sounds are normal active in all 4 quadrants. I'm going to do light palpation now. You tell me if this hurts you at all, okay? No pain or discomfort? Okay. Now I'm going to do deep palpations, okay? And we know we should not be able to palpate the spleen or the kidneys. No pain or discomfort with that palpation? Okay. Now I'm going to look at your legs, okay? I'm just looking. They look good. Hair is evenly distributed. Skin looks good. I'm going to touch to feel the temperature now. And I'm feeling for any edema. I'm going to take your shoes off. I'm going to palpate your dorsalis pedis pulse. Perfect. Perfect. Now your posterior tibial pulse. Okay, these pulses are equal, bilateral, they're symmetrical. Now can you pull each knee to your chest one at a time as far as you can get it? Okay, and the other one? Okay, now stand up. Can you do your leg out like this so we can test your hip range of motion? And the other one? Okay. Let me actually check your capillary refills on your feet. You can have a seat. Okay, less than 3 seconds for each toe. I'm checking for any deformities. We've already inspected legs and feet. Okay, we did need a chest. Can you tell me where we are?
Clinic.
Uh-huh. Can you tell me your name?
Mark.
Can you tell me what year it is?
2020.
And who is the president?
Donald Trump.
Okay, good job. Okay, now I'm going to get you to stand up. We're going to do range of motion of your spine. Can you face that way and lean forward, lean backwards, lean to the left, lean to the right, look to the left with your spine, look to the right. Okay, good job. We're going to do Romberg test. So I'm going to have you stand with your feet together. Now shut your eyes. Just testing his. Okay, you can open them. Okay. Do heel to toe. I'm going to assess your gait. Can you walk like this, heel to toe? Okay. It's good. I'm just trying to make sure we haven't missed anything, sir. I think that is it. Okay, we are done.